I'm going to focus on talking about obstructive sleep apnea. Now, sleep is critical to human health. One of the problems that we get with sleep is sleep apnea, and I'm sure many of you have heard of it if you haven't already got it or been diagnosed with it, or you've got very sore ribs because you probably haven't been diagnosed with it, but someone you know has made that diagnosis. And what happens is that during sleep, gravity and other things tend to push some of the bits at the back of your throat, especially your tongue and the upper pharynx, so that it obstructs your upper airway. And that happens because your muscles tend to be relaxed when you're asleep. And your body, which leads to a number of things. One, your oxygen falls down, which is bad for your health. It activates your sympathetic nervous system. It drives impairments to your immune system. And it does nasty things to the rest of your body, particularly your heart and your brain. Your body reacts to that by wanting to wake itself up because it likes to breathe, and that will disrupt your sleep, which we call an arousal from your sleep. And that can be happening repeatedly throughout the night. In some people, 100, 120 times a minute, so every 30 seconds. And if you stop breathing for 30 seconds, that means you're essentially not breathing at all, and that is bad for you. We measure the severity of that by a count, simple count of how many times you stop breathing per night. Symptoms: snoring, people notice you stopping breathing, you feel like you're choking and you wake up with it. You have nocturia. Getting up to go to the toilet is a significant symptom of sleep apnea. And that, we'll go through the rest of it if you like. You have restless sleep. During the day, you feel tired, you feel sleepy, you have low energy. You wake unrefreshed, you might have headaches in the morning. Your memory and your concentration will tend to be impaired, and in particular, there's a very strong association with mood problems and depression. But it's not just the sleepiness. We tend to focus on the bear. That map of the human body shows that there are significant physiological, clinically important impacts on pretty much every organ in your body from obstructive sleep apnea. Your brain, your heart, your lungs, your immune system, your blood pressure, your liver, your urinary and sexual function, your cholesterol levels, your sugar, and, as I mentioned before, your mood and well-being. Risk factors: men have more of it than women, although it becomes quite common in women post-menopause. Increased weight, although that does not explain everything, and maybe 40%, maybe even 50% of men in particular with sleep apnea are not overweight or obese. Too much alcohol, sadly, is a contributing factor. And then there's contributing things. The way your face is designed makes that more of a problem as well, because if you tend to have a jaw that goes backwards, you obviously don't have enough space for that all to occur in. As I mentioned before, it may not just be those symptoms we talked about. People with hypertension that is difficult to manage, so people are on 3 or 4 medications and they can't get their blood pressure well controlled, may well have undiagnosed sleep apnea. People with atrial fibrillation, very common as people get older, particularly again if it's hard to manage, will often have sleep apnea. Heart disease, strokes, diabetes, mood disorders, insomnia. We've always sort of over the years suggested that people who fall asleep easily because they're really sleepy have sleep apnea, and the ones that can't fall asleep are insomniacs and they don't. That's not true. 30 to 50% of people with sleep apnea have insomnia, and I'm not concentrating on that tonight, but I'm happy to talk questions about it because that's a slightly different way of managing that problem. People with alcohol and smoking and many sort of muscular diseases, but it's quite a different problem. How might you identify, if you want to self-identify, or if your GP wanted to identify why that might be a problem? There's a couple of questionnaires that we use that are good for screening. This is one of them, developed here at Flinders University actually, that really just goes through the simple stuff, called an OSA 50, which relates to central truncal obesity, your waist circumference, whether you snore, whether anyone stopped you breathing, and are you over 50. Positive score on that increases your risk of, suggests you may have a risk of sleep apnea. The alternative one is a thing called the stop bang, where again, goes to the symptoms. Do you snore? Do you feel tired? Has someone seen you stop breathing? Do you have high blood pressure? Is your BMI up? Are you getting older? Do you have a thick neck? And are you male more than female? Now, scores on that increase your risk. If you are also sleepy, this is a thing called the Epworth Sleepiness Scale. 8 questions about how likely you are to doze off or fall asleep in certain situations, which range from the sort of ones where you're more likely to. You're sitting in a darkened room at the cinema, you're watching TV in the evenings, to you're driving along a road in a car, which is somewhat more discomforting, but not impossible. The reason we put all them together is if you've got positive scores on one of the questionnaires, plus a score of 8 on this, your GP can refer you directly for a sleep study without coming to see me first. And you get a Medicare reimbursement for that. And that's only relatively recently, probably in the last 12 to 18 months, that's been possible. And you can get those studies through various places, public hospitals, or there's a number of services elsewhere that can do it too. Why might this be important? There is certainly an association between sleep apnea and cancer. Here's some data around the risks of moderate and later severe OSA. And you remember we count that by how many times you stop breathing an hour. And you get about a 40 to 60% increase in risk of all cancers if you also have obstructive sleep apnea. And this is the risk of someone with obstructive sleep apnea. Do they get cancer later on? About a 60% chance of the increase. The other point I'd like to point out is sleep apnea is very underdiagnosed. Probably 50 to maybe 70% of people with sleep apnea in the community don't know they've got it. So the chances are there's a substantial number of people, men who have had prostate cancer or have prostate cancer, have undiagnosed sleep apnea. And that may be contributing, as I mentioned, to not everything, but a number of other symptoms that might be significantly causing problems. And this is the evidence around prostate cancer, which is the commonest of the cancers that are associated with sleep apnea, and about 1% annually of people with sleep apnea will develop prostate cancer, which is a substantially increased risk. And you notice there that's about 4 to 5 times the risk of the incidence in the general population. Can you treat it? Yes, you can. It's like Bob the Builder. The commonest, as we probably all know, is the CPAP machine. And what that is a machine that produces air at positive pressure to the atmosphere. So you have it a tube, and you wear a mask, and the air that comes in just splints your airway open. The physics of it is fantastically simple, which is good for us sort of simple respiratory physicians. It was first developed in Sydney by a man called Colin Sullivan, who foolishly sold the rights to somebody else. And most of the best machines in the world are made in Australia as well. So it's a long-standing treatment. It's one of Australia's great contributions to world medicine, really. You only use it when you're asleep. It often has a humidifier and a heating tube so that it becomes more comfortable and the air isn't cold and uncomfortable. It stops you snoring, which is popular with people in your immediate environment, and it starts working straight away. It has lots of potential benefits, but one of them I'd like to point out is it has a significant, clinically important impact on mood and depression. It's a meta-analysis of a number of studies, and it has about a 20% decrease in absolute diagnosis of depression. So people go from depressed to not depressed. Its effect size, which we talk about, is about 0.6 of a standard deviation, which in actual fact is twice the benefit that you get from the average of oral antidepressants. So if someone's got sleep apnea and they're depressed, this is a good idea. Not everybody is excited by the idea of sleeping every night looking like Darth Vader. I understand that. The alternative, or one of the alternatives, is this, which is what we call an oral device, a mandibular advancement splint. And it looks like that thing on the left. And what that is a mouth guard worn top and bottom with a hook that pulls your lower jaw forward on your bottom jaw. kind of looks like that. And what you can see is your lower jaw comes forward and it creates more space at the back of your throat. And for many people, that's quite adequate to get rid of the problem. You need your own back teeth to anchor it on because it'll pull a denture out. And it's better for people with mild to moderate sleep apnea. It's often better for people who are younger or have lower BMI. It's very good for people who get sleep apnea mostly when they're lying on their back, which is actually the commonest form of sleep apnea. And it's quite good, proven to help with things like hypertension and symptoms. Less good if you have really severe sleep apnea or you spend a lot of time with low oxygen. So, summary, sleep is important for your health. It is biologically important. They're very common. Effective management exists. As an aside, both the things we've heard about so far today in terms of exercise, and we're about to hear about diet, are also very effective treatments for sleep apnea. So exercise is good for everything, including your sleep. And diet obviously is very important for a number of reasons. Losing weight, but also it will tend to help with your sleep in general, particularly when you eat and what you eat when you do it. I'm sure we can hear about that later. So what I'm saying is if you think you might have any sense of a problem with regarding your sleep, seek help because you'll certainly be able to sleep when you're dead, but that's not necessarily what we want.